Hi, this is Sandra Handysides, nurse practitioner at GTB Clinic. I'd like to go through the story of Bighost Ndimoen, Hope. I'd like to invite you to go back in your memory to nearly 18 months ago. Local schools were closing and sending children home. Travel restrictions were put in place. Many workers were told to work from home or even just sent home for good. A sense of unknown and foreboding was inescapable. SARS-CoV-2, the virus that causes what is now just referred to as COVID, was spreading with little known about it, and even more limited ways to test for it. Remember the isolation? The fear that hugging your elderly loved one might cause them to get sick or even die? The weeks turning into months, wondering how many people in your circle would be infected? Which ones were strong enough? Then also wondering how long could we possibly live in this holding pattern of unknown and isolation. Terms like social distancing, quarantine, self-isolation, exposure became part of our everyday language. Normal interactions, as we know, changed seemingly overnight. A few weeks turned into a few months. Community members started to get sick, and a few precious ones left us. Important community events were canceled in efforts to protect everyone. With winter approaching, it was hard to imagine another year like this. With spikes and waves came seeming no end in sight. We knew that vaccination against influenza was an important step in the right direction for facing the winter months. Discussion of COVID-19 vaccines possibly being available by Christmas seemed too good to be true. We listened in anticipation as vaccine studies were reviewed, plans started to be made. Could there be light at the end of the tunnel? Then, early December, we had the first COVID vaccine arrive at the GTB Health Clinic. It brought a wave of hope. Here you'll see our very own nurse Mary receiving the very first doses of the vaccine and preparing it for the healthcare workers that serve GTB. As many of you have seen, Mary was the very first person to receive the vaccine, and that was first of many thousand that GTB was able to administer. The epicenter of hope is the Strong Heart Center, which enabled us to give 100 vaccinations in one day, week after week. I just loved this picture of us in the winter with the sun breaking through the clouds, and it just really represents how we felt with the ability to give this vaccine to others. Since December 2020, we've been able to give 3,873 plus doses. On the left you see myself and Mary. We can't stop smiling after a day of vaccinating and spreading hope. On the right, you'll see GTB Fire and Rescue as they helped monitor recipients post-vaccination at the Strong Heart Center. They were there through all sorts of weather and just watching everyone. No serious reactions have occurred. After these mass events, we've been able to start doing pop-up clinics made possible by the new medical trailer, which is shown here at an evening pop-up clinic at the Windy Hills GTB neighborhood on Herkner Road. I'd like to just talk about how the mRNA vaccines work. We have been able to give all three types of vaccine. We have Johnson & Johnson, we have Pfizer, we have Moderna. The Pfizer and Moderna are the mRNA vaccines, which has been an incredible technology they've been able to use that creates a messenger, that's the M part of RNA, mRNA, a message that teaches your body how to recognize the spike protein that is specific to the SARS-CoV-2 virus. It is basically a template. There is no virus in this vaccine. It is a template that teaches your body what to look for, how to recognize this spike protein, how to attach to this spike protein, and then ultimately destroy the virus. There's different handouts available to download next to the link to this video. And I really encourage you to look at all of them. There's a lot of really great information, and this is one of them. Just to cover some of the myths about COVID vaccine. There's so much information to sift through, and it's very easy to, come across misinformation. So, one myth, getting the vaccine will give you COVID. Absolutely not true. The side effects you feel after vaccination is your immune system's response. We have to have an immune response, otherwise we're not teaching our body anything. So what you feel, the body aches, the fatigue, some people get headaches, that is what your body feels like when your immune system is in high gear. Your immune system actually functions best at a slightly elevated temperature, slightly above normal body temperature. So some people do experience mild fever. That's just your immune system doing its job, and that's exactly what we want it to do. These side effects last about 24 to 48 hours after vaccination, and most typically after the second dose. Another myth is that the vaccine can change your DNA. DNA is inside the nucleus of your cell and is the blueprint of your entire body. It's actually quite difficult to change DNA, and messenger RNA, which is what the Moderna and Pfizer vaccines are made out of, they do not enter the nucleus, okay? They enter into your cell, but they do not enter into your DNA, okay? It gives the message, it sends the message, it gets broken back down into amino acids, which is the building blocks of your body, and gets reused and broken down completely. Yeah, it will not affect your DNA. And there's also a link on this handout where you can go get more information. To date, we have been able to vaccinate 58% of all GTB members, 12 years and older, who are the ones who are eligible for the vaccine. We've also been able to reach 80% of GTB elders. And let me clarify, these are members who live in our 6-county area. We definitely have all vaccines still available. We have an open schedule. We have self-scheduling. You can call to be scheduled. We are encouraging everyone to get vaccinated. At this point, you will either get COVID or you will get vaccinated. And the risks of getting COVID, you don't know if you're going to have long COVID. You don't know if you might have more severe disease. And there's just so many different ways that we're finding this virus does affect your body. And so maybe feeling a little worn out and down for 2 days after a vaccine is certainly less risky than getting the disease. It's important to get your second dose. That's how you're getting this higher level of immunity. And then continue to protect yourself and loved ones. As you know, and I'm sure you've heard about the Delta variant, there are some more breakthrough cases. That means people who are vaccinated can still have a small chance of being infected. This is because the Delta variant is much more transmissible. It replicates and multiplies so much faster that you can spread it without actually becoming ill yourself. The reason the message has changed is because when we first started vaccinating, there was not the Delta variant in wide circulation. And so breakthrough cases weren't happening to a larger scale. And it was very unlikely that you were going to transmit the virus if you were vaccinated. Unfortunately now, as the virus changes, our recommendations have to change. But it is still far safer to be vaccinated. You are still far less likely to have any kind of severe illness or hospitalization or death once you are vaccinated. I'm sure everyone's kind of tired of hearing about the COVID vaccine. It's been a huge focus of attention, and rightly so. It is the way out of this pandemic and the way back to being in our community in the way that we would like to. However, I do want to also cover other vaccines that we do have available at the clinic. Again, these handouts are available for download, and I really encourage you to take a look at them. And also, children under 12 are still not yet eligible for COVID vaccines. However, childhood vaccines may prevent other potentially severe illnesses. So check with your child's pediatrician or with the GTB Family Health Clinic to make sure your child is up to date on all vaccines. Back to school vaccinations are due, and soon it will be flu season as well. Please stay tuned for flu shot clinic information when this season's flu doses are available. Vaccine information flyers you see here are available for download on the links provided. And they do have different handouts for different vaccines such as measles, Hib, flu, and then just in general questions about baby vaccines. If you have any questions at all, please call the Family Health Clinic at 534-7200. You can speak to a provider or a nurse. If you are interested in scheduling a COVID vaccine, please call 231-534-7475. That is our COVID vaccine hotline. And leave your information there and we will gladly call you back. Again, that's 534-7475. Miigwech.
Program we've introduced here at the Grand Traverse Band Family Health Clinic is called Let's Heal. Let's Heal is a telehealth program that allows you to be seen by a Grand Traverse Band provider from the comfort and safety of your own home through your computer or smartphone, making healthcare more convenient than ever before. Telehealth allows patients to be seen by their doctor via virtual visits. Visits are completed on your computer at letsheal.com or on your smartphone with the Let's Heal app. The Let's Heal app is available free for both Android and iOS. Simply open your app store and search for Let's Heal. Virtual visits can be easier to fit into your busy schedule. With telehealth, depending on your schedule, you may not even have to take time off from work or arrange for childcare. Telehealth is more convenient and accessible than traditional in-office visits. Patients who live in remote locations, people who are homebound, or simply cannot take time off work can access care virtually at their convenience. Telehealth visits are great for chronic disease management, such as diabetes, high cholesterol, or high blood pressure, cold or flu symptoms, reevaluating medication, seasonal allergies, urinary tract infections, rashes, stomach flu, strep throat, follow-up appointments, and more. Certain conditions and visits still need to be conducted by a provider in office. These are visits such as testing for COVID-19, strep, and blood work, any required imaging, and physical exams for school, work, or athletics. Caution: if you are having a medical emergency, please call 911 or go directly to the hospital. This service is not to be used for true medical emergencies where care should be timely and in person. We will soon offer GTB Behavioral Health Services on Let's Heal as well. With a behavioral health televisit, you can get help with issues such as anxiety, ADD, depression, eating disorders, and panic attacks. We will inform members when this service is available. Regular visits with primary care providers, such as those specializing in family medicine, internal medicine, and pediatrics, are essential to your family's health. Some of the benefits of regular care are to detect potentially life-threatening health conditions early, limit the risk of complications of existing conditions, and form a good partnership with your doctor so treatment can be more efficient. With Let's Heal, we've given you another tool to manage your health. Signing up for Let's Heal is simple. An email address is required to create an account. To sign up, contact our Let's Heal coordinator at 231-534-7478. The coordinator will ask a few basic questions and create your account for you. You may also ask for a registration form at the clinic registration desk. Once registered, you will receive an email at the address you provided welcoming you to the service. You can be connected in minutes to a provider here at the Grand Traverse Band Family Health Clinic during regular clinic hours by calling the registration desk to schedule an appointment. Ask for a telehealth visit. You may also ask your provider to schedule it for you. These visits are no cost to all eligible tribal members and can be treated as regular office visits. Visits with GTB providers are available only during regular clinic hours, 8 a.m. to 5 p.m., Monday through Friday. In addition to regular office visits with GTB providers, tribal members within the 6-county area are eligible for 4 covered visits per year. These visits are conducted by an Amwell provider. They can be used for common conditions such as those already mentioned. These are available to covered members 24 hours a day, 7 days a week within the Let's Heal app. Visits on Let's Heal are simple. When it's close to your appointment time, you will receive an email with a link to click. This will take you to your appointment waiting room. Once the doctor is logged in, the visit will start. Alternately, for after-hours visits, go to the providers page and select an Amwell provider from the options available. Providers on Amwell are part of the Amwell Medical Group, which is a primary care practice with a national network of board-certified doctors. Every Amwell provider goes through a rigorous selection process to become part of the network, and you can be assured with the care provided as, on average, Amwell providers have 15 years of experience. Giving you peace of mind, Let's Heal is also private, secure, and HIPAA compliant, meaning your health data is safe. If you have any questions or would like to sign up, please contact our coordinator at 231-534-7478. We are truly excited to offer this program to our tribal members. We wish you continued health. Thank you.
Hello, my name is Emily Schmidt and I'm a family nurse practitioner at the GTB Health Clinic. Today I will be discussing 2 important cancer screenings that we offer here at the GTB Health Clinic, and those are breast and cervical cancer. First, I'd like to start out by discussing breast cancer screening and why it's important. Breast cancer is the 2nd most common cancer among women. Breast cancer screening guidelines recommend that women should begin screening for breast cancer with a mammogram every 2 years, starting at age 50. The decision to start screening for breast cancer at age 40 may be appropriate for some women after having a discussion with their primary care provider. Once a woman reaches age 75, the decision to continue with mammograms is another one that should be individualized depending on the woman's personal and family history. Next, I'd like to discuss the screening test for breast cancer, which is called a mammogram. A mammogram is a series of X-ray images of the breast, and it allows for detection of breast cancers, tumors, or cysts. However, an area that appears abnormal on a mammogram will require further investigation with a biopsy. A biopsy looks at the tissue of the breast to determine whether or not the abnormality is cancer. A mammogram is a quick procedure, and most women describe the experience as mildly uncomfortable but not painful. The radiation exposure that a woman receives with a mammogram is also quite small. I do recognize that all of this sounds a bit scary and intimidating. However, we know that there are currently 3.8 million breast cancer survivors living in the United States, and the number is expected to increase. This is because of improvements in diagnostic testing and advancements in the treatment of cancer. After a diagnosis has been made, if it is, we here at the clinic will help facilitate a referral to a specialized physician that can discuss treatment options with you. Next, I'd like to discuss cervical cancer screening with you. The cervix is the part of the body where the birth canal connects to the uterus. All women are at risk for developing cervical cancer, and it most commonly impacts women over the age of 30. The main cause of cervical cancer is from the human papillomavirus, also known as HPV. This is a common sexually transmitted infection that can be passed from one person to another. Approximately half of sexually active people will have HPV at some point in their lives. When cervical cancer is detected early, it is highly treatable and associated with an excellent quality of life. Cervical cancer screening is done with a test called the Pap smear, and it's recommended that women start the screening test when they turn 21 years old. In women who are 21 to 29 years old, we recommend that they have a Pap smear done every 3 years. When a woman turns 30 until she's 65 years old, we recommend a Pap smear with HPV testing, which is done at the same time, and that is done every 5 years. There are some caveats to this. As women get older, and after the age of 65, they no longer need Pap smears, as long as their previous has been normal. And women who have had a hysterectomy with removal of the cervix do not need screening Pap smears anymore either. So you may be wondering what a Pap smear actually is. And a Pap smear is a test that is done to collect cells from the surface of the cervix, and these cells are then examined underneath a microscope to look for precancerous changes. The test itself is quick and just a bit uncomfortable, but most women do not report pain. The results of your Pap smear will then indicate a plan for follow-up. There are some common misconceptions about Pap smears. These are different than a pelvic exam. A pelvic exam is a general term that does not necessarily include a Pap smear. A Pap smear is done with a pelvic exam and includes testing for cervical cancer. So oftentimes women will think they had a Pap smear done in the emergency department or an urgent care setting. However, oftentimes this is just a simple pelvic exam. Additionally, Pap smears are not required to obtain birth control, and they are not normally done every year as long as you've had normal results in the past. There are several ways to help prevent cervical cancer from occurring before it starts. And one of the primary ways to do that is by getting vaccinated against the human papillomavirus, which is a vaccine that we do offer here in clinic. Other ways to prevent cervical cancer are by, of course, obtaining Pap smears, not smoking, and using protection during sexual intercourse. So this concludes my presentation on the screening tests for breast and cervical cancer. I want to thank you for your time, and we look forward to seeing you here in clinic.
Ani Bonjour. Welcome to the Medicine Lodge. Mary Rayfield in Dishnakas, Pishabi Town in Dojabal. My name is Mary Rayfield. I'm a registered nurse at the Grand Traverse Band Family Health Clinic. I've been a nurse here for about 25 years. I am a tribal member, and I would like to give you a tour of the Medicine Lodge. So this is the first place that you will come to. Human services are right over here. Dental services are through that door, and I will take you into the medical clinic. The waiting room, where we have the 4 directions. We have all the doors secure for your privacy. And this is the medical records department. So let's proceed down to nursing. So we have a couple of nurses, other nurses that work here. Mickey Pino is a tribal member, retired nurse who has been here for about 30 years, and she's on vacation today. Shirley Elpers is the other nurse, and she'll be in here in a moment. Shirley Elpers is our other registered nurse that works here. She's been working with the tribe for how many years?
6+ years.
Yeah, and she's a member of the community also. She lives about a mile down the road.
Yes, I do.
So we wanted to just let everybody know that the nurses, work as a team with our medical providers and our nurse practitioners to provide direct patient care. But we also do nurse walk-in appointments. You can come in any day, Monday through Friday, from 9 to 11 or from 1 to 4. You do not need an appointment, but call first to let us know that you're coming in. And some of the services that we provide are, we do lab draws with a doctor's order,
We do a lot of phone triage for patients.
the full gamut of immunizations for adults and children,
We do blood pressure checks for patients.
EKGs,
Breathing treatments if they need one.
blood sugars and A1Cs,
Urinalysis.
pregnancy tests,
Strep tests.
Depo-Provera injections and injections of other prescribed medications,
Medication refills if they need them.
COVID tests and COVID immunizations,
We do a lot of insurance prior authorizations when the insurance doesn't approve it.
and probably a very important service is that we do urgent first aid and the phone triage. If you have any kind of questions, feel free to give a nurse a call at 534-7200, and that's area code 231. Come on this way and I can show you a patient room. So we have 3 adult rooms, and we can go out. I'll show you the pediatric room. So a little bit more room, more toys. We have everything's littler for kids in this room. And this is Dr. Reed, our chiropractor.
Hi, I'm Dr. Reed. I'm the chiropractor. This is my treatment room where I take care of everyone. If you have any aches or pains, come on in and visit me. You can take a ride on this fun table that likes to go up and down, kind of like a carnival ride.
He saves a lot of people's backs.
I do. That is my job. Backs, shoulders, knees, ankles, elbows, anything, any joint, I can move it.
Hey, come on in.
Hello.
Hi. My name is Emily Schmidt. I'm a new family nurse practitioner here at the clinic and happy to be here and start seeing patients.
Okay, so this is what we provide inside, but we do provide services outside. And that would be COVID testing, COVID immunizations. So come on this way. All right. So this is part of our pandemic response. We've done COVID testing through our checks. Here's our COVID testing facility. People stay in their car and drive up here. We maintain specimen and wear full PPE, and we take the specimens inside and run the test within 1 hour of collection, and people follow the results. I'll show you our COVID immunization trailer. Now this trailer is mobile, and we take it to Benzie, we've taken it to Traverse City and Charlevoix. Here's all of our supplies. We have a refrigerator for storage. Let's see. Sandra Handysides is our nurse practitioner, public health. She's a doctorate in public health. And she's organized and led our pandemic response. We welcome everybody to come check us out.
Ani, Angelina Raphael, Indijna Khas, Pishabi Town, and Dojaba. I work at the Grand Traverse Band Family Health Clinic and Purchase Preferred Care as Benefits Coordinator. I am also a community partner with the Michigan Department of Health and Human Services and a certified Medicare Medicaid Assistance Program counselor. Today we're going to be talking about Medicare. On the screen you'll see Medicare insurance card. This is a sample of a card. It should have your name, Medicare number, your entitled Part A and Part B, and the coverage dates. Normally, someone 65 and older or disabled for 2 years with the Social Security Administration would qualify for Medicare. In this slide, I'll talk about Medicare Parts A, B, and D. Part A is hospital, like urgent care visits, emergency, things like that. Part B, medical, that's outpatient care. Office visits, skilled nursing, there's a cost associated with Medicare Part B, which is $140.50 this year. Medicare Part B can cover up to 80% of the majority of your medical costs. This will get deducted out of your Social Security check, or it could be billed in 3 months intervals if you're not collecting your Social Security retirement at this time. Part D is a separate card. You would use it at the pharmacy. It's out-of-pocket premiums and the amounts vary. Part A and B enrollment. Receiving Social Security retirement, you'll be auto-enrolled and your card will be mailed to you about 2 months before your 65th birthday. If you're already receiving Social Security disability, again, you will be auto-enrolled, and that will start the 25th month after receiving disability benefits. If you're not receiving your Social Security retirement, then you would have to enroll yourself. The initial enrollment period is 3 months prior to your 65th birthday and 3 months following. But basically, you would want to sign up before your birthday. You would want to create an account at www.ssa.gov, or you can call the Social Security office. If you need assistance with that, you can contact me anytime and I can, give you some more feedback on how the best way to do it. One of the things that you'll notice once you get Medicare eligible, you'll get tons of mail from the Social Security office, CMS, Medicare, and if you're eligible for DHS, you'll get mail from them too. One of the easiest ways to spot something that's legit, they'll have an eagle as the emblem on it. You'll also get tons of advertisements, things that are mailed to you. You'll get the shiny, glossy colored mail. It'll say advertisement all over it. You'll see television commercials. You may possibly get calls. Even before COVID, they had people walk up to your house and try to have you enroll with them personally, face to face. So just be mindful of not giving any information to fraudulent people. Medicare Part D. Medicare Part D is prescription coverage. There are various plans based on your medication that you currently take in your zip code. Open enrollment for Part D is October 15th through December 7th, and this is an annual thing that happens. You may qualify for a program called Extra Help, which pays for part of the Part D prescription plan costs. It has an income and asset-based test. You can apply at www.ssa.gov. It takes about 10 minutes. I can help you apply too. You might actually receive a letter from Social Security that says that you automatically qualify. That means you don't have to apply. You may receive a letter that says you should qualify, you should apply, and they will include an application with that. You can fill it out and mail it back, or you can give me a call and I'll help you fill it out online. Next, we're going to talk about dual Medicaid and Medicare eligible. Now, this is an amazing program. It's also income and asset based. For a single person, around $1,000 a month, you would possibly qualify, also based on your assets. Medicaid will cover your Part B that gets deducted out of your Social Security. It will also cover your Part D plan. That application process, it only takes me about 15 minutes to apply. And I would go to the new mibridges.michigan.gov website to apply there. You can do it yourself, or if you need assistance, I can definitely help you with that. Usually there's like an annually follow-up that you have to submit documents like your income and your bank statements. I'm always willing to like send your stuff in through fax or scan it in, whatever's easiest for you to make it more convenient so you can keep this great program. Above there's samples of the Michigan Medicaid card, your Medicare card, and another sample of the Part D prescription card. If you don't qualify for the dual Medicaid and Medicare, and if you're over income, the tribe has a program that supplements the $148.50 that gets deducted from your Social Security. They'll reimburse that for you through PRC Medicare Part B reimbursement program. The requirements are a welcome to Medicare meeting, pretty much similar to the one that we have had right now. Your current year Social Security benefit amount with Part B deduction, your Medicare card, your tribal ID within the 6-county area, and if you choose to do direct deposit, I have those forms available. Now, the form goes to accounting. I have nothing to do with the direct deposit or the checks. I just send the list to accounting and they process that. The reimbursement for the current month is typically processed and mailed the last business day of the month. I do an annual update in January. Last year, because of COVID, I did it at all the satellite sites, but everyone was safe in their cars, masks up, and I just took a photo of their document so no one had to go in the building and congregate. It seemed like it went really well and we didn't have any problems. So we may do something similar to that this year. Well, I guess we'll see. Once again, I'm Angelina Raphael. If you have any questions, please don't hesitate to contact me. My info is on the screen. If you'd like to call, or if you like to text, I have a work cell that you can text to. If you're better on email, you can do that. I try to make it as easy as possible. I hope that you found this informative and helpful. Bamapi.
Good morning, beautiful people. This is Kristen coming to you from the Grand Traverse Band in Peshabytown, Michigan. I just wanted to give a few tips and tricks on some oral hygiene care that you can do at home during this unprecedented time of the COVID-19. As most of you probably know, the mouth is the gateway to the body, and it's super important to stay up on your oral hygiene. So I just wanted to show you a few things. First of all, proper brushing is super important. We recommend 2 minutes for 2 times a day, both morning and night. If you kind of divide the mouth up into 4 sections, a quarter, a quarter, a quarter, and a quarter, and you focus 30 seconds in each area, you'll get a pristine, clean, lost a molar. So when you first go in, I want you to start with some light circles going down from the gum line. Make sure you're reaching inside to get the biting surfaces. Lost another molar, and tipping in. When you're done going around in each area, make sure you do light circles coming all the way around to get the gum line. Most commonly missed areas are right here in the front at the gum line, up here at the gum line, and also right inside your lower front teeth. So now I want to go into flossing. Flossing is super important. I typically recommend flossing before bedtime. That way any food or debris you've had throughout the day isn't sitting in there while you're sleeping. It's super important to make sure that when you go in, you focus that there's a piece of tissue that comes down between your teeth. So when you're flossing, you have to make sure that you go up one side and then come down and do the other side before you fully move on to the next area. So I'm going to try and demonstrate this on a front tooth just so it's easier to see. So if you're going to come in and floss here, we're going to go down one side of the tissue, make a quick C shape, come up, go down the other side, making a C shape to get underneath the gum line to remove any bacteria that's down there, and then you can come up. And then you would move on to the next tooth, go down, come up, go down, come up. Another easy way to floss at home are these flossers on a toothbrush handle. Very affordable, about $3. The thing of refills is also about $3. The only thing with floss picks or apparatuses like this is to make sure that you're still getting on both sides of the tissue. So again, you would go down one side, come up, go down, and come up. So really nice option. I do recommend a sequence of brushing, flossing, and rinsing. So I would want you to brush your teeth before bed, floss, and use an antiseptic Listerine mouth rinse or something like that, just to kind of make sure you're getting all areas of your mouth. And also, sugar-free gum is a great option to have on hand when you're not able to brush. However, we're all at home right now, so there's no excuse to not give yourself 2 minutes 2 times a day. Remember to keep it clean.
Ani, my name is Darylyn Berryman, and I'm the referral coordinator at the Grand Traverse Band Family Health Clinic. And today I would like to show you what I'm having for breakfast. It's my Newman porridge. I took about a 1/4 cup of wild rice and boiled it in 2 cups of water. I'm going to add about a 1/4 cup of dried cherries, about a 1/4 cup of pecans, or you can add your favorite nuts of choice. Have about a 1/4 cup of non-dairy milk, and 1 tablespoon of maple syrup. Give it a good stir, get it mixed up in that hot, freshly steamed rice. And you're going to want to take about a 1/3 of this. See how it tastes. Oh yeah, the nuttiness of the rice, the crispiness of the nuts, that tartness of the cherry, really good together. If you have any leftovers, you can just refrigerate it, cover it up, refrigerate it. You can have it the next morning, or you can have it cold on top of your salad, add a little bit of lemon juice in there. You can put it on top of oatmeal. You can just eat it again, reheat it as you would like. So I just wanted to give you all a little sampling of what will be coming to you in the fall. Is native cooking for life food classes that I'll be certified in to help you reduce your medications for diabetes and for some even reverse the disease. So thanks for joining me today at our virtual health fair. Have a good rest of your day.